And welcome back to Good Things Utah, talking now about something difficult to diagnose as it may take months or years to find out what's happening. Lyme disease symptoms can mimic other diseases. Joining me now in this sponsored interview is Charlene Watson and Dr. Calva there with Rising Health Specialty Clinic to share more. Welcome to the show, you two. And Charlene, I want to start with you. Tell us more about Rising Health Specialty Clinic and what you do there.
Rising Health is a clinic that we focus on chronic illness, hormone balancing, and metabolic diseases, specifically with weight loss in a medical sense. So we are different, and we're more of what people are looking for that can't get just in a Western type of clinic.
And Dr. Calva, let's turn to you. What do you do at Rising Health?
I'm a physician who works there, and I have been doing weight loss, wellness, metabolic issues, and also now treating Lyme disease too. So we also look at root cause analysis and look at the real cause of why we get disease. I'm tired of working on conventional practice where you just throw pills at people and don't find out why they're sick. That is where Rising Health and my provider group really get to the bottom of the health issues and try to do our best to find the reason.
That's where you do it differently. This is a different approach, everybody. Charlene, tell us about chronic Lyme disease. What is it?
You know, that's a big subject, but if you look at the CDC website, it says 450,000 people a year are diagnosed with Lyme disease. That's a little bit phenomenal because the type of testing that is being used to report that is insufficient, it's ancient, and yet we're still getting 450,000. So that type of testing only covers 30% of the people who are ill. So if we start thinking about those numbers, we're into the millions. It's an epidemic. Chronic Lyme disease is created by a spirochete, or a bug, called Borrelia. Borrelia is a large infection. It's 22 amino acids long. If you think about strep throat and the pain, the fever, miss work with strep throat, it's only 4 little proteins long. Our immune system has the capability of helping cure strep, but when it hooks onto a little Borrelia, it just kind of drags it around. You really do need help to overcome Lyme disease.
So Dr. Calva, what are the symptoms? How would our viewers know if they're impacted by Lyme disease?
We call chronic Lyme as a great imitator. It can go into any system. It starts from migraine headaches to joint pains to memory loss, brain fog, muscle aches, poor sleep. So it involves pretty much every body systems.
And it's a great imitator.
That is right.
It's also rheumatoid arthritis.
Yep. It instigates autoimmune disease too.
Right.
And now we are having some studies that say that many culprits with Lyme that we see are Bartonella, and these other bugs are also causing cancer. There are studies that are showing that in the latest research.
Charlene, is there Lyme disease here in Utah?
Of course there's Lyme disease here in Utah. If we look at the CDC website, it shows a whole map of the United States and the reporting states. And every state in the nation is reporting Lyme disease. So we know that there's hot spots right now in California. That's not the East Coast. We have Lyme in the Rocky Mountains. We have Lyme Midwest. So these symptoms, like Dr. Calva was saying, do we have it in Utah? Well, if you have any of those symptoms, and on top of that, I want to make a comment about how absurd it is to think that deer, birds, coyotes don't migrate. Of course they don't stay just back east. So do people get on a plane and travel somewhere else in the United States?
Of course.
Of course. So it's really silly to think we don't have Lyme in Utah. The reason why that thought sticks around is we're not trained as providers. You have to do extra training to understand how to recognize Lyme disease.
And it can be so frustrating because, like you said, it is the great imitator. So it could be a number of things and you're not getting correctly diagnosed.
Right.
There is an event coming up on November 15th. Who can attend and how can that help our viewers?
Every year, we go to multiple conferences and scientific outcomes that we study and we participate in, and we bring that back to our clinic and we report it to our community. It's a free event, November 15th at 6 p.m. Anybody who wants to sign up, it's right here. You can see how to get to our website.
RisingHealthSpecialty.com. That is the website located there in Holladay. If you have been frustrated, if you want to know more information, again, that is via Zoom, and that is a free event. It is virtual. abc4.com/GTU for more. Dr. Calva, thank you so much for being here. Charlene, thank you so much.
Thank you, Nisha.
Appreciate
Thank you
it.
so much.
Thanks again to Rising Health Specialty Clinic for sponsoring that interview.